And live from Brussels and France, it's ZN Live. I'm very happy today to have a very special guest, Dr. Angus Thomson. Angus has extensive experience in a whole range of areas, from Sanofi and UNICEF to his own company, IRIMI. He's worked on behavioral change, on vaccine misinformation, and we've actually had the opportunity to collaborate on a number of things. So Angus, I'm very, very happy to have you on the show today. And I want to start with a question that I think is quite challenging, which is, we've had this pandemic, which we know has generated a lot of misinformation on the internet that was referred to as the infodemic. How bad do you think the situation has got? Do you think things have got much worse, or do you think that people have started to react and get better in terms of misinformation on the internet?
Hi, Phil. Good question. Thanks for having me. All of the above, I think. So as someone who's worked in vaccine, in particular vaccine communications for over 15 years, I think it's been a double-edged sword for us. We've seen a massive surge of misinformation around vaccines, but this was nothing new to us. One of the advantages, I think, or one of the positive things that came out, is that people are now aware that there is a lot of vaccine misinformation out there, and that it's misinformation. We saw varying success in terms of the national responses to communicating around vaccination programs, which in turn had varying impact upon, in particular, public trust in the programs that were being put in place in the health system and the government in general. And that is also quite a heterogeneous effect that we've seen across all countries in the world. In some countries, we've seen good responses by the health authorities, which have in turn built public trust and brought us to a place where there's greater trust amongst the public, which is the foundation of vaccine acceptance and uptake. But in other countries, we've seen erosion of trust because of poor communication, inconsistent communication, etc. So the answer to the question is, vaccines are on people's minds, so that's a good thing, because they used to be a fairly invisible thing. I think we need to look back and learn some key lessons from the pandemic and from what worked and what didn't work, to ensure that the next one, which will be coming probably sooner than later, we're able to respond in ways that value public trust, that ensure that the public are involved in the whole process of rollout of a vaccine. Over. Can you hear me? I'm happy to keep talking about it.
Yeah, no, I think that's a very, very good point. Just by the way, I have a slightly unstable connection, it seems. So keep going if I just drop off.
Okay.
But I want to come back to, the broader picture. I was in India with the IPA, the International Pediatric Association, on a conference. Sorry? Can you hear me?
Yep.
Sorry, I don't know if you can hear me, but I was just saying that I was at the conference from IPA, and basically we have been having a very interesting conversation on vaccines, and essentially the question was, what is the role of practitioners like HCPs and in particular pediatricians in this conversation? We've been involved together on training this community of doctors. Before, I think that there's now a greater receptivity from them. Actually, I found the engagement was greater than before. So I'm kind of optimistic, especially because they are seen as the critical voice in this conversation. They are seen as the people who can have the most impact. So Are you optimistic that we can bring more people into this conversation and that this goes to this happening?
So I think you made a very important point, which is which relates back to
from our audience, that people, are you optimistic about? Keep going.
So you made a very important point. I referred to trust repeatedly in my first comments. As communicators, you should all obviously understand that the communications, the messages, the content that we develop and is only a part of a communication, and that effective communications are more conversations than one-way transmission of information, and that we get our information, the information that we integrate into our decisions, from people that we trust, or more importantly, people that we consider trustworthy. That means people who we consider to be experts in their field, competent in what they do, but most important of all, that they have our best interests at heart. Why is that? Well, I think it was President Roosevelt, who said, "People don't care how much you know until they know how much you care." So the key here is that it's trusted voices are very, very important in any conversation, but in particular in the conversation that we're discussing, the vaccination conversation. Now, pediatricians are consistently found to be one of the most trusted voices on vaccines and other things across many, many countries. But the question is, are they always acting as trustworthy voices? Are they actually letting people know how much they care before letting them know how much they know, first of all? And then the second thing is, are they out there talking in conversations where their authoritative and trustworthy voice is needed, such as online, so on social platforms? So the training that that your team developed and that we integrated into the IPA training course, that focuses on helping pediatricians get into the social conversations, I think is more crucial than ever. And it's unfortunately, I couldn't be there due to visa problems, but I'm pleased to hear that you felt that there was a greater willingness for them to step up and start communicating with the public in fora that they're not necessarily used to, and they're potentially uncomfortable with. And it's very, very important. We need to not just fill the information gaps around vaccination and, of course, other public health interventions and other social issues, but we need to fill them with information that's coming from trusted voices. I see that you're not with us, Phil. I'm going to keep talking a little bit about the training and trustworthiness. So the second training that is in this global program that I developed with Professor John Parrish Sproul from Indiana University focuses very much on that idea of people not wanting to know what you know until they know that you care. So we train health professionals to talk in a certain way, to hold conversations in a certain way that is likely to build the receptivity and reduce the reactivity, the psychological and actual physiological reactivity of the people they're speaking to. And we tell them that how you speak to people is actually probably more important than what you say, because nobody's going to take something on board until they have decided that you are a trustworthy source of information. So I know we gave that training again, but I think, looking forward, what are the things that we have to do? We really need to be mobilizing and equipping health professionals to have better conversations in the clinic, and to be speaking in the conversations that are going on, in particular online, but also, the offline community, the conversations in offline communities. We should also be considering who the other trusted voices are out there. It is very often health professionals, but there are certain communities, in almost any community, you can identify trusted leaders or trusted voices. They may be religious or community leaders. They're the kinds of voices we need to get online as well. So I just had a question from somebody as we wait for Phil to rejoin about vaccine fatigue. And I think we're at a tipping point or a turning point in terms of COVID-19 vaccination. Certainly, people are tired, probably, of hearing about vaccines. At the same time, we would never have emerged from the pandemic without those vaccines. But they're probably weary from the complexity of the discussions, the conversations that they've been listening to. Complexity that comes from the reality that we had multiple vaccines, fortunately, for the first time, multiple effective vaccines, but multiple vaccines of differing effectiveness that we see with any vaccine, with slightly different safety profiles sometimes, and these vaccines being distributed differentially to different countries. And now we're in this period where we're all hearing about boosters and we're getting to the second or third booster. I think the solution here is that countries will have to work rapidly now to transition COVID-19 vaccination into routine vaccination. It should become probably an annual vaccine for at-risk people in particular. So the elderly, those with chronic diseases, much as we do with influenza vaccination. We have to turn it from the nth booster to an annual dose for a very clearly defined and clearly communicated population.
Yeah, I think the booster topic is really critical here, because basically people are very confused about what this vaccine is. So I think, as you rightly said, communication, explaining, setting the expectation is going to be critical. Now, I also want to talk about some of the new technologies that are out there. People have been talking a lot about artificial intelligence, in particular ChatGPT. Do you think these tools can help us better inform people? I mean, it's not been great at incredibly reliable information. We have ups and downs. I actually did a live demo during my training session because I believe that it can be used as the intelligent assistant, but that you have to check. So it can remove some of the work. Do you have any thoughts on how this might change the conversation and how it might help get accurate information out there?
Yeah, my first thought is actually it relates back to what you said about people's expectations. And one of the challenges we have with vaccines is that people have expectations that they're 100% effective and 100% safe. Now, nothing in life is 100% effective. Let's look at ChatGPT, for example. It's doing a pretty good job, but it's not 100% effective. And as we've seen, I think with the Bing chatbot, it's not 100% safe either, right? I like to say if only everything in life was as safe and effective as vaccines. But I think, our experience in an early program that you may remember from around 2013, where we tried to get health professionals online, the one takeaway was that they don't have the time to create the content. And if you don't have content, nobody's going to listen to what you have to say. So I think the first clear use of them is exactly what you just said, to support the voices out there to have some small amount of regular, albeit small amounts of content that they can post. Obviously, they would need to be editing what they're getting, but I found it to be quite effective. And with a quick scan, it's almost like having a writer who doesn't quite know your subject area. You skim it, you make a few edits, and then it's ready to go. So that's I think a positive angle of it. We have to understand that the authors of disinformation are very good at their game. They're very good at their game because they're making billions of dollars. We've seen that they're making billions of dollars with vaccine disinformation. There's studies that have shown that from the Center for Countering Digital Hate. We've just seen the Israeli group who've been producing disinformation and selling their services for large fees to bad actors. It's a big business and they're very good at it. And therefore we can expect, Phil, that they will also be thinking about how they can be employing these tools as well. So we're in a bit of a race and we have to be as good or better than them. So I think tools like AI can help us find the information. They can help us develop the information, but we still need the information to be transmitted or communicated from trustworthy voices. One, I think if we're able to work with the organizations that have these chatbots to support really rigorous content moderation in terms of the content that is related to dangerous health outcomes, hate speech, etc. The kinds of things that we've been trying to do with some of the other social platforms. If we're able to have those conversations and these tools are able to be trained to provide people with reliable content, then they will become also, I think, Phil, a very important source of information for people. I mean,
Absolutely.
I'm looking up information about the different vaccine boosters, and ChatGTP is giving me some interesting information that I know is reliable. Over.
Yeah, no, I think that's a very good point, and I suspect and I hope that the tools are going to be indeed, as you said, trained on data sets that are reliable and then checked. And I think again, you constantly, and I think this is true all the time, you have to have your scientific mindset and be critical, because you never know if the information is correct, so you need to double check. But I think it can help with at least some overall information, also some language rollout, so that people can actually have access to information in different language things, which sometimes are difficult to see, and maybe to kind of organize the information in simpler ways, because it's very difficult for the moment to find that information. And we had a couple of comments. I just want to flag them. How about HPV for boys? How do we convince them? Another point by Justin. Interesting point. We should communicate about the flu, about COVID like the flu vaccine. I think this is something that we were talking about. And indeed, we have other sources of information like Fox News. Before we go to the recommendations, I just want to ask you, what is your suggestion for people who are working in healthcare communication? What are the things that you think they should be focused on to really move things forward at this critical moment? Because we're in this post-COVID world now. What do you think people need to do to really improve things significantly?
So give me 2 minutes for this. We see our world through a slightly foggy lens of cognitive biases or heuristics, our values, our beliefs, etc. So we're often struggling to make sense of information, and we're more likely to adopt information that is consistent with those lenses that we have, that we all share. So the first thing is we have to take a social behavioral approach to our communications. We have to understand what is behind people's decisions, certain health decisions such as getting vaccinated. And we have to understand that at a fairly granular level. Unfortunately, we've been testing messages across a number of countries, A/B testing messages with very different framings, with very different kind of behavioral levers behind them, and finding that some work here, whereas others whereas they don't work over here. These ones work in this country, but they don't work in that country. We've got to start understanding what's going on inside people's heads and also what's going on around them in their lives. I guess the way I summarize it every time is we need to speak with people, not at them, about what matters to them, not what matters to us, as, for example, me, a public health professional, where they are, so online or offline, in a language that they understand. And I see Justin's just mentioned languages is very, very important as well. We also have to talk to them about things that might be relevant, or that's the bit. So if I can just relate to the HPV and the flu comment, if we've got time, I mentioned 100% efficacy, that expectation. Well, HPV vaccine for boys isn't preventing cervical cancer, but it's preventing, depending on the vaccine, genital warts, which are a pretty awful thing. And I can assure you, if I had boys, they'd all be vaccinated against HPV, because I would be able to take that out of their lives as a worry. Flu is the same thing. We talk a lot about flu and the mortality, but what we know is influenza infection increases your risk of heart attack, increases your risk of stroke, increases your risk of complications due to diabetes if you're a diabetic, and it increases them by threefold, by sixfold. So you are not just taking the vaccine to hopefully not get influenza, but you're taking it to hopefully avoid those outcomes, those other outcomes that could be caused by a viral infection like flu, or as we saw with COVID-19. So, speaking to people about how vaccines or how things work in a way that they can relate to. So my tips are that I've got 2 links. The first one is related to, sends you to the vaccine communication guide that I wrote when working with UNICEF with colleagues at Yale. And the second one is the one that's just gone there, the misinformation management field guide. For those who are interested in misinformation, have a look. I gathered the data, the evidence that was written a couple of years ago, but some very interesting stuff in there about how we can inoculate people against misinformation. And I've got some exciting projects in that area that maybe we can talk about another time, I guess. Are we coming to the end?
Absolutely. So thank you. You got the 2 recommendations. I'll share my own recommendation as well, which is the actual IPA Vaccine Trust Project, the online training that we worked on together with Dr. Naveen Thaker and the IPA team, which I believe is really interesting. I think over 7,000 doctors have taken the test, have taken the training, and they've done an in-depth study where they got a lot of positive feedback. So we can share the link to that training. I think that's the kind of thing that more doctors should be doing. And indeed, the more good information we can have access to, the better. And I think that's why the links that you just shared are very useful. We're going to share them below as well. And I think that everything people can do to educate themselves, to be able to understand and then to share with other people. And as you mentioned and Justin said, we need to speak the language of the people that we want to reach, whether it's, literally the language, but also the language in terms of preoccupations, in terms of needs, in terms of fears, in terms of concerns. Now, my feeling is actually we're very far from doing this well for the moment. And actually the gap in some sense is getting bigger. Polarization and fear and anti-vax sentiment is continuing to grow. So I think there's real action that's needed. But I think we know what needs to be done, but I think it needs to be done at scale. So I would say that's probably the next big action that we need to do. But Angus, thank you so much for sharing all this with us. Indeed, we will continue this conversation face-to-face, online, with the different projects that we're working on, and on a follow-up discussion. So I hope you have a fantastic weekend, and I will see you online if I don't see you face-to-face beforehand. Thank you very much.
Thank you very much, Phil. Thank you, everybody.
Bye-bye.
Bon weekend.
Bon weekend.